being lifted, the virus is the same virus. Nothing has changed. And so I think that the fact that people are accepting policy decisions as if that actually has some impact on health is troubling. It's troubling. Yeah.
Right. I mean, so moving forward with the numbers still sort of, some people say they're declining, but not at an important or significant rate. When moving forward, what are still the things that we need to be mindful of and just take with us, and most importantly, educate each other about as we go on with our lives? I mean, I know people, you got to work, you got to eat, you got to live. I get it. But I mean, what are still the things that we have to and we need to be mindful of and share with one another as we continue on?
Yeah, I think, well, first of all, when we look at where we are, it's a public health emergency that has evolved into a medical crisis and an economic crisis. And actually, when you look at public health as a discipline, by definition, it means assuring conditions where people can be healthy. That also includes economics. So I think one of our challenges as a nation is that we're separating health and economics when in fact economics feeds into health. So clearly we can't be shut down forever. I mean, I don't think anybody argues that point. The challenge is there are certain populations, African American populations specifically, have a higher burden of chronic disease. And that's because of a lot of things. It's because of some social things. It's because of economics. It's because of access to health care or lack thereof. But the bottom line is that you have a segment of the population that is not more likely to get infected, but more likely to get very sick if infected. And so that's a fact that we have to keep in mind as a people. The reality is the only thing at this point that we can do about the coronavirus is to prevent it from infecting us. And you can do that by the proper hand washing, 20 seconds. If you use sanitizer, only when you can't use soap and water is best. But even when folks use sanitizer, they tend to just put a little dollop on. You actually have to use enough sanitizer as if you were using soap and water. Yeah. So people tend not to use the right amount of sanitizer. And then the other thing is, if you don't have to go out, don't go out. If you have to go out, if you have to work, you still have to do the hygiene, but you have to wear a face mask, a face covering. The face covering actually protects other people from you. But what happens is if everybody wears a face covering, we will each protect we will all protect each other from ourselves. So the face covering, the only thing it does is serve as a barrier so that if you are infectious and you're asymptomatic, you don't infect another. But if everybody does that, then we all help each other out. I did not see, to any great extent, face coverings today.
Now, as far as being outside, I mean, are you at a greater or lesser risk? I mean, when we're looking at the weather, some people may point or make reference to, okay, it's sunny outside, the wind is blowing, you're sort of in an open space. So you're not necessarily as susceptible to actually contracting anything because you're sort of guarded. Now, is that the case, or are you still pretty much at risk or greater risk even?
Yeah, so you're at less risk the more air circulation you have, but it depends. You could be in an open area, for example, folks are going out and exercising, and that's fine and good. And you could pass someone who coughs or exerts some respiration and exerts the virus, and the wind could be blowing such that it impacts you. So it's not a whole lot we can do about that. But I think we have enough evidence to say that if you are in an environment with a closed environment with other people, you need to have on a face covering. If you are outside in the open in nature, maybe not.
Now, you mentioned a segment of the population, some at greater risk than others. Now, are there numbers that show, is this age related? Is this health related, genetic related even? How is that breaking down, or could you better in some ways explain?
Yeah, it's mainly health related. And so what's happening is you probably have heard comorbidity. So when people are sick, when the body is already challenged, or if people are immunocompromised from various things. When you bring in this novel virus, the body has to mount a response. And if it's already taxed, then it's not able to do that as well. And so what you see is people who have chronic disease are faring worse. And when you look at the data even before the pandemic, African Americans had more chronic disease. So that's why you're kind of seeing what looks like, it almost looks like COVID is going for African Americans, but the fact of the matter is COVID is going for anybody who's compromised. And that's why you're seeing also in older individuals, nursing homes. It's about the compromise. It's about the compromised system, and you're putting an insult, a brand new virus that the body has not seen, that it has to fight against. So the as much as your immune system is strong, as much as you're healthier, you're probably going to fare better. That's what the evidence is showing. But there's some differences. We're seeing some differences. For example, there's some things now that are coming up in children, which was not expected. So, people are still learning a lot about the virus.
As far as vaccination, I mean, a lot of people are, hoping and praying and by all means wanting to see a quick solution. But I mean, you've had, you were there, if I'm not mistaken, doing the whole H1N1 phase, the different swine flus, and how they had to go through a process of actually finding an accurate or a substantial cure. Do you see that part being something that will carry over for potential years or maybe months to come, as far as actually finding a cure, a vaccination for COVID?
So two different things. One, the vaccination is to prevent, the disease from occurring. And of course, the cure is once you have the disease to combat that. Vaccinations, actually both, but vaccinations in particular, take time. And the time is not only around the scientific inquiry, but to test that in people. There is a process that protects people so that, you don't go too fast and put something in people that may cause a problem later. So there are clinical trials, and so there's time. So with vaccinations, it tends to take about 1.5 years. There are a lot of things going on that's fast tracking that. There's no reason not to think that will not be fast tracked. But as you probably have heard, the expectation is that we have another wave of COVID to come in, probably in the fall. And it's likely going to happen before we have a vaccination. Now, there are some treatments that are coming online. And it looks like one of the newer treatments looks promising. But again, it is for people who are sick. It's actually for people who are very sick. So it's after you're in the hospital. But that's still a good thing. So science is just not that fast. And so what we can do at this time is, besides hand washing, is the social distancing, which flattens the curve. And you've heard that a lot. And that's really about cases. Right. So my biggest concern about what we're doing here in Georgia and other states is it looks like it's over, but it's not over. So what you're going to have is you're going to have people rushing back out as if nothing happened. And then that curve that was flattening because people had started social distancing is going to spike back up. And actually, folks know that. They've said that on the news. And the question is, how do we fare in that? And again, people have to work. I get that. And there's a responsible way to do that. But there are a lot of people out who don't have to be out. There are people out socializing. There are people out, doing things that are not absolutely essential, that are going to not help the curve continue to be flattened.
Now, if I can kind of change go a little bit further as far as the impact of COVID. You've always been a huge advocate for education in terms of getting the degrees, gaining the knowledge, and challenging yourself enough to take that extra step and getting as much education as possible. Now, the job market right now, a lot of people have been laid off from their jobs. A lot of people have really felt the impact from an economic standpoint, as we alluded to earlier, to what this has done to the job market. With that being said, does this in some ways, will it allow more people to be mindful of their career path? I mean, because you're looking at the fact that education market, as you know, is still strong. You look at some government affiliated jobs still standing strong. You look at some areas of IT, and you making reference even had another to choose or to pick was healthcare. So with all that being said, especially for maybe graduating seniors, rather high school or college, do you think that this should be a wake-up call in terms of how you choose to carry out or follow a career path?
Yeah, the coronavirus pandemic has wreaked havoc economically because the very thing we need to do is stay home, right?
Mm-hmm.
And so the industry that's been most affected is service industry, where you have to engage with people, and those that have been most stable are the ones that are engaged in the public health response, the ones that are engaged in the medical response. Essential services have not, been affected. But I do think that what this says to young folk is that I know I teach public health students, and I know as years have gone on, a lot of students want to be entrepreneurs, and many can't really tell me what that means, except that they'll be on some social media and make money. But I think that what this helps us to do is to be very thoughtful about what is the path you choose. My husband and I were talking about this as it became apparent that we're blessed to be in two different professions that were not impacted. In fact, we have more work to do because he's in medical technology, I'm in public health. And so, so there are some fields that seem to be more resilient for something like that. But, one of the things I hope that young folk think about seriously is government, politics, setting the rules of engagement, because I think that's where we're really falling short of having enough voices at the table to say, wait a minute, no, we have to protect all populations and we have to open in a way that doesn't put anybody at risk. But the folks who can say that are people who have lived it, who are sensitive to it. And I think we don't have enough young folk who go into political science, who go into, who want to be representatives or senators or Congress folks and all of that.
Any and all forms of government, or any particular local, federal?
I think from local on up. We just don't have enough folk who are even drawn toward that. Mm-hmm. And I think that one thing that this pandemic has illustrated is how important it is to be at the table making the decisions. Because see, that there's plenty of data. There's a lot of things we don't know, but there's plenty of data. But it depends on who's making the decisions as to how they want to use that data. And so you have to have people that are sensitive at the table to be able to say, let's look at this a little bit differently. So certainly healthcare, and as you mentioned, IT, medical fields, but I think those government, policy making, pushing the envelope, making the decisions, we've got to have more people at the table. It just, when you look at who's delivering information to us around this pandemic, you don't see enough of us. And so. And
this is really not even to the younger generation. We still have time for even the millennials. Everybody, I don't want to call baby boomers even, could still have an opportunity to have an impact and make this be sort of an eye-opening experience.
Absolutely. Yeah.
Anything else. So I appreciate you so much. Dr. Stephanie Miles Richardson. I won't shout out your accolades and your titles. They can look up your bio and find out who you are. But this is definitely a panel of information, shared information, and needed information as we head into another week with more restrictions that are lifted, more risks that are involved, and more education and awareness that's needed. We sure enough appreciate you, Doc.
Absolutely. Stay vigilant.
Music, interviews, podcasts, and so much more. John Louis Radio, next level.